Hi, my name is Dr. Jason Smith, and I'd like to share with you some new information about some causes of fibromyalgia and something that we've been using with our patients that's given many of them relief. Now, if you've been diagnosed with fibromyalgia, you know that fibromyalgia is something where you've got basically pain all over. It's usually lasted not just a few weeks, but usually several months and even on into years and decades. Now, according to the American College of Rheumatology, fibromyalgia has several different diagnostic criteria. A few of these are all listed, just a few of them. One of them is that you have to have widespread body pain, not just, say, in one arm, but both sides of the body, and also pain above the waist and below the waist. You also have to have at least 11 of 18 different trigger points, which include from the neck, the spine, the low back, and even down in the legs. There's also several other conditions which a large percentage of fibromyalgia sufferers experience, and these are things such as headaches, numbness, dizziness, memory disorders, depression, and even sometimes speech difficulties where you forget the words that you're trying to say or you don't understand. Some people call it fibrofog. What these criteria tell me as a provider is that fibromyalgia is simply not a muscle problem. And for a lot of the treatments that are available out there for fibromyalgia, you'll find that a lot of them are designed at decreasing that muscle pain. If it was just a muscular problem, the muscles are one of the fastest tissues, soft tissues that heal along with the skin. So these conditions would have already been resolved at this point. But like I said, fibromyalgia is not simply a muscle problem. Fibromyalgia, from my perspective, and this is something that makes our office different, is more of something that's neurologic on one hand and also metabolic on the other. Fibromyalgia patients have actually a lot of inflammation throughout their body, and not only in their body, but they also usually have actually some inflammation in their brain. Now, there's different areas of the brain that are affected with fibromyalgia. There's this area down at the base of the brain, right at the back of the head. It's called the cerebellum, and the cerebellum is a critical part for functioning in the brain. If your cerebellum is not functioning right, your body does not function right. The cerebellum is involved in balance. It's involved in spinal muscle tone. It's involved in smoothness of muscle motion. It's involved in eye movements, and pretty much all organ function and learning is helped by having proper cerebellum function. There's another part of the brain that's involved as well, frontal lobe, and another part called the upper brainstem. That's called the mesencephalon. Now, in fibromyalgia patients, I tend to see cerebellums that are either weak or under firing or out of balance, meaning more dominant on one side versus the other. But a lot of fibromyalgia sufferers actually have upper brainstem overfiring, meaning it's firing too much. There's too much activity in that area of the brain. Now, one of the signs that you might have an overfiring brainstem in the upper part is you're having problems sleeping. The upper brainstem is right where the sleep centers are located. It's also where your nuclei for integrating light and sound activity is going through. So if you have light sensitivities, sound sensitivities, and a lot of people with migraines have that as well, then you're most likely having some dysfunction with the midbrain. Now, what causes fibromyalgia? Pretty much from what I've seen, there are many causes, but they can be categorized in broadly in the following three. Usually, there's been some sort of physical trauma in the past, whether it's a motor vehicle collision or a fall. There's some type of physical trauma that has occurred to the central, the spine or the brain. Maybe some mild brain trauma or a concussion, some type of physical trauma. The second broad category is chemical trauma, where there's been a prolonged period where maybe the diet's not as healthy, or there may be some food or chemical sensitivities, and this can also cause enough inflammation that the brain tries to shut down and protect. And the third broad category is mental or emotional trauma. A lot of fibromyalgia sufferers have gone through maybe a death of a spouse or a painful divorce or some trauma with one of their children that's just caused them an immense amount of stress. And the body can internalize and actually react in an inflammatory way to some of these traumas. Now, how do you determine what part of your system is dysfunctioning and how to go ahead and take steps to correct it? Well, in our approach, we use a functional metabolic testing, and we also do neurologic testing on the other hand. Functional metabolic testing could be doing blood work. It could be checking the adrenal and the cortisol levels. It could also be finding out what food or chemical sensitivities you may have, or what kind of gut dysfunction you might have. On the other hand, functional neurology allows us to find what parts of your brain are not functioning how they should, and what parts of your brain are not communicating with the other areas of your body. Using these two approaches, we can help a large percentage of our fibromyalgia cases. If you're interested in receiving more information about learning how our approach is different from maybe what you've experienced in the past, I'd encourage you to request our full-length DVD on treatment and fibromyalgia recovery, and we'll be glad to get that information to you. And I hope you find this information has been useful. Have a great day.